and the very real impact it has on people. I want to update you as usual about how coronavirus is affecting the NHS in Wales. There were fewer than 100 new positive cases reported yesterday. Many local authority areas in Wales are now reporting fewer than 5 new cases a day. The number of new cases has been steadily declining since the beginning of April, even though we are doing twice as many tests. The number of people dying from coronavirus has been falling since the middle of April, and most people who have had coronavirus have not needed hospital treatment. All our health boards generally continue to be at green or level 1 status. There are 3 hospitals reporting level 2 this morning. We have 4 levels of system escalation to reflect pressures up to red level 4. Around a third of our acute hospital beds are empty. That's around 2,200 beds. This is lower than last week and continues to reduce because we are seeing a return to normal NHS activity. There are more than 1,000 people in hospital with coronavirus. This includes about 300 people who are on what we call a recovery pathway. They have been treated and are now recovering from the virus in hospital. There are 354 available critical care beds in Wales, including additional capacity. More than 62% are empty and available for use. 44 people are being treated in critical care for coronavirus. This is again lower than last week and the lowest we have seen since the 27th of March. The majority of people being treated in critical care now do not have coronavirus, which shows that more NHS work is taking place. Up to yesterday, based on our operational data, around 5,400 people have been discharged from hospital who have been admitted for COVID-19. I wanted today to focus on the exceptional way that our emergency departments have responded over recent weeks. This has been a testing time for staff working in our emergency departments. They have responded with resilience and much skill in a very challenging environment. I want to thank them for their professional response and the way in which they have cared for people, especially as changes have been introduced to services. We have introduced a new national pathway to separate people with coronavirus from those without. This has supported timely care and treatment in our emergency departments. In May, activity in emergency departments across Wales has fallen by a third overall compared to last year. But among some age groups, the reduction is even bigger. The largest decrease in activity has been among children and young adults. Attendances are some 60% lower than last year. We would urge parents who are concerned their children may need urgent or emergency care to dial 111 or 999 in an emergency. There has been a 40% reduction in attendances for the over 75s. It's important that people with potentially urgent conditions continue to come to hospital when they need help. We have also received reports from clinicians in emergency departments about an increase in people with anxiety or emotional distress and people who have presented later than they should, leading to additional health complications. For this reason, it is essential we maintain access to emergency care for all those people who need it. If you're coming to an emergency department, please don't be alarmed if you see NHS staff wearing face masks or other protective equipment. They are wearing this for their protection and, importantly, for yours. We are working with clinical leaders across the emergency care system to do this and to maintain some of the physical changes we have made to emergency departments to prevent overcrowding. We want to continue to manage people's health in their local community as much as possible so they don't need to come to hospital unless it's urgent or an emergency. This will mean using digital technology and imaging capability and signposting people to the best services for their clinical need. For some, the first port of call won't automatically need to be A&E, as other services can meet their needs safely. For those with less serious illness, the 111 website is a good source of information and advice on where to access services. Our GP practices and pharmacies continue to be open and available. It's important that I pass my thanks on directly to all our NHS and care staff across Wales who continue to work so hard to care for all those who need it during this pandemic. I also want to acknowledge and thank all of our critical workers outside the health and care system for the work that they have done to keep the public safe and protected, and for their ongoing support for our NHS and social care services. It would have been impossible to maintain our response to coronavirus without their contribution and efforts. Please continue to support our NHS and care system by following our advice to stay at home. If you do go out, please stay local. Thank you. Diolch yn fawr. As usual, I'm going to just move to some of our questions coming in remotely, and today I'm starting with James Crichton-Smith from ITV Wales. Good afternoon, James.
Afternoon, Dr. Goodall. England and Scotland have gone live with their contact tracing programmes today across the whole of each of those countries. Wales hasn't. There's fewer than 4 days until the government says it wants to start here. Will the system be available across Wales, up and running on June the 1st?
Yes, we are on track to have our contact tracing process in place from Monday next week, so that's from the 1st of June. We've taken advantage over this last couple of weeks to make sure that we have been able to trial our approach to this, working with health services, with local government and other stakeholders, and have been able to use the trials that have been in place across 4 of our health board areas, covering a range of different areas in Wales. And we have made progress also in the recruitment of staff who are part of this approach, and we have been able to have 600 of the 1,000 staff who we expect to ultimately need to be in place at this time. Obviously, as we start our contract tracing approach, some of the lower community transmission rates that I've described at this stage, including that number of local authorities now reporting lower than 5 cases, will actually help us to embed this. But there are certainly some lessons that we've learned over this last couple of weeks on the trials that have been in place.
You mentioned recruitment. Do you say you haven't recruited all the staff you need at the moment?
We will need to get up to a number of 1,000. We don't need that from the first day. That's a progressive number that we need to put in place. But we have 600 available and in place. And I think one of our advantages over these last couple of weeks is our ability to actually use existing staff with experience in this public health arena, environmental health officers, those that are working on the health areas. And we've been able to actually use existing staff within our public services at this stage. So we didn't need to have the 1,000 number in place from day one, but we've made good progress to 600, and we'll expect that number to keep increasing and certainly in line with the demand that we expect. James, thank you. Okay, thank you very much. I'm going to move to Owain Clark, who is from BBC Wales. Good afternoon, Owain.
Dr. Goodall, thank you very much. Could I just stick initially with the track and tracing policy? The fact that it isn't being switched on right now in Wales and that work can't start right here, right now, like in England, like in Scotland, does it at least give the perception to people once again of Wales being behind the curve, behind where it needs to be?
I think we've been clear about the dates that we've been aiming for, and the Minister was able to give out a ministerial statement earlier on this week confirming that we would be looking for this to be implemented from the 1st of June. Clearly we are tracking our normal public health surveillance mechanisms, Owain, so our ability to make sure that we've been able to keep an overview of the community transmission rates across Wales. We also need to remember that the testing approach that we're introducing is part of the set of measures that we need to put in place. It's really important to make sure that we still have the ongoing efforts on the ground, the need, for example, to make sure that we have good infection control, both in our hospitals and our care homes, and those mechanisms continue. But clearly, to move to the next phase of using our available testing capacity does require us to make sure that we're able to move into the test, trace and protect strategy. And we are in line with the guidance and with the timetables that were set by the Minister.
Could I switch to NHS activity now? You mentioned in your opening remarks more normal activity increasing, but I'm not clear what that means to a patient, for example. If I was on a waiting list for a planned operation, do I take it that waiting list is happening now, that people are being seen? What does it mean to a patient who had those waiting lists suspended? Are things back to normal now?
Yeah, we're not at all at a normal position, Owain, at the moment. Obviously, it was a very significant decision that we took back in March to step away from our routine NHS activities. And I think alongside cautious steps that we've taken in terms of the government reflecting on exit from lockdown, I think it's really important to recognise that the NHS itself needs to make its own contribution to that. So we issued an operating framework a couple of weeks ago to the NHS. We've had responses to that, and it shows how the system and the service wants to start to be able to introduce extra activity in a number of different areas. I would still state that our focus is as much as possible to ensure that emergency and urgent patients are prioritised within that approach. Looking to my definition of returning to normal activity, some of that is seeing a little bit of a recovery from some of the normal emergency and urgent activity levels within our system. So seeing a level of cancer referrals starting to be reintroduced, having seen a drop a number of weeks or so ago. Seeing our emergency admissions, whilst they're still lower than I would expect, but they have recovered from the lowest that we saw at the end of March and into April as well. But we want people to take a phased approach based on their local confidence and their assessments, and to use their available capacity, because we do have 2,000 beds available, and we know we may need those for a contingency. But it's important that we're able to move our way forward to having a more routine level of activity. I would expect that it's going to take us some weeks and months to really bring those things forward, but what I would be expecting in the interim is any opportunity we have to use the change of technology, for example, to allow outpatients to be seen, that we can utilise those as part of our response in Wales. Okay, thank you very much, Owain. I'm going to move to Mark Smith from Wales Online. Good afternoon, Mark.
Good afternoon, Dr. Goodall. As we know, the Welsh Government is set to make an announcement tomorrow on what new steps it will take to ease lockdown restrictions. From your personal perspective, what measures would be safe and sensible to introduce now, and which would not?
We've had to maintain a really clear message in Wales over this last 3 weeks to ask people to stay at home, if they need to go out, to stay local at this stage. And I thanked the public for their reaction to that, particularly the way in which we have seen Wales still be very quiet over a bank holiday weekend. I think our concerns are that we do need to maintain a cautious approach on this, certainly in terms of ensuring that the NHS and social care system remains resilient and available. The Cabinet were reflecting on this yesterday, because it's the formal trigger point to actually review lockdown. And I know the First Minister will be making announcements tomorrow about what that looks like for the people of Wales. But certainly, I think this has been a really important 2 or 3 weeks that we can see has genuinely contributed to an ongoing reduction of community transmission, and also an ongoing reduction of patients in our critical care beds and in our hospital beds. So as an example, I reported earlier that the number of patients in critical care units for COVID-19 is the lowest that we've seen since the end of March, for example. And I think we just would like to maintain some focus on making sure that this virus is not able to get hold again in Wales over the forthcoming weeks.
Oh, thank you very much. And secondly, could you give us a bit more of an insight into how the 4 tracing trials have gone in Wales, and what have been some of the successes and indeed failures of the scheme?
Yeah, so really important to make sure that alongside any national announcements, and just a reminder that whilst we have always had mechanisms for tracing contacts in terms of normal public health outbreaks, the thing that is different here is the scaling up to do it on a countrywide basis. What's been really important, I think, on the learning is to make sure that that is not only a health initiative. Of course, it's a public health initiative because it's supporting populations, but it's been really important to recognise the skills and experience that we have, of course, in the NHS, but actually more importantly outside of that. And I think certainly working with local government, I think, has broadened out our approach to this at this stage. In fact, one of our approaches to the trial has been the ability to also look at some ongoing work that has happened in Ceredigion, where, given very small transmission units within that community, they've been able to continue with a level of contact tracing anyway happening within that vicinity. And I think that's been really useful to see that they've been able to maintain that all the way through. But certainly we wanted to make sure that we were able to have a balance of the different areas represented by Wales, urban and rural, and make sure that this was something that was going to be fit for purpose. But more than anything, I think it's just the learning about the importance of the partnership approach that could be taken forward. Okay, thank you very much, Mark. Just going to move to Dan Bevan from LBC.
Thank you, Dr. Goodall. Good afternoon. Can you give us an update on the trialling for the track and trace system? Of course, there's been 3 health boards that have been involved in that. What are the teething problems that you've had to overcome? And if I could pick on something that you mentioned earlier, you don't need the 1,000 people in place, the staff in place by Monday, but when do you need that 1,000 staff by?
Well, starting with the latter, we have always indicated within the Test, Trace and Protect document that there is a range that we may need to aim for. And when the community transmission rates are at that lower end, that will affect the numbers of physical staff that you need. But if the virus is on the increase, you will need to expand those further forward. So it's not about aiming to have all of those 1,000 recruited in the next 1 or 2 weeks. It's about making sure that we're able to recruit in line with the demand that we see and the pressure that is placed on that contact tracing system. I mean, as I was just saying earlier, I think importantly, we have led this initiative by making it about our stakeholders and our public services in Wales working together. And this could have been seen as a uniquely health-only initiative. And I think if we're really going to have an emphasis around the protect approach to the Welsh population, it absolutely needs to recognise the role of those other public services. So some of the teething issues on this, are the ability to make sure that we can, hold some of the data, track through the information, obviously have the call handling facilities in place for this, make sure that we understand that there are differences in the way we would respond perhaps in a city environment rather than in a rural environment like West Wales. So lots of small pieces of information that are very helpful in developing a national approach for Wales.
And sticking with the track and trace system, are there going to be fines for people who are non-compliant? Of course, if someone's flouting lockdown restrictions, they may not want to give their full contact list, but it's very important that that is obtained. So therefore, excuse me, if somebody doesn't want to give that full list because they might get a fine from flouting restrictions, will you give them immunity from that?
I think our approach is to reflect on the way in which the public have really helped us over these recent weeks by being open about our approaches, describing the efforts that are required to be undertaken collectively to see that we are able to make a difference in this arena. And I accept that there is detail that is needed from individuals, but again, as a reminder, in the very early stages of this virus outbreak, we were undertaking contact tracing within Wales. That was because there were smaller numbers and we had the capacity that was available at that time. But we found that people were very open and understanding about those areas. Now, there may be a time in the future when the government may wish to review the need for fines, but I think the first steps, and this is certainly our approach around what we've launched, what we are launching for next Monday, is to actually work alongside our community and the public to make sure that they understand the reasons and the rationale. But we'll again have to see how those first weeks go, Dan, and if there is a problem with that, we will need to revisit it. But our general approach has been to work with the public, not through that penalty approach. Okay, thank you very much, Dan. Now moving across to Tom Magner from Carers World Radio.
Good afternoon, Dr. Goodall, thank you. Slightly different issue, if I may. When Wales starts to move out of lockdown, people will be coming into contact with staff, not just in non-surgical areas of hospitals, but in such places as shops, care homes, restaurants, and on public transport. What's your advice to staff dealing with the public in the wider world about routinely wearing masks, including the type or types that is or are best to use?
So the Chief Medical Officer has provided advice in Wales on the use of face coverings and of masks. So from an evidence perspective, there is very minimal evidence of that having a positive impact, other than wanting to ensure that people adopt normal good practices. There is evidence that from a face coverings perspective, that if people are in a more crowded environment, so in your examples, Tom, that could include shops, crowded shops, or indeed on public transport, that if people choose to use face coverings, then that might be helpful for them to do so. Some of this is about whether people are trying to protect themselves from receiving the virus from others, or rather protecting others from themselves. And our underlying message in Wales is that if people are going to choose personally to use face masks or face coverings, is to still ensure that they abide by our general principles, which are to maintain social distancing, to ensure that they are taking precautions, and not to see that as changing their behaviour or their practice at this stage. But the Chief Medical Officer's advice in Wales is pretty clear. People can choose to wear face masks, they can choose to wear face coverings, but we've not made it a requirement in Wales.
Obviously, people can look at the Chief Medical Officer's advice, but when it comes to someone choosing to wear a face mask or face covering, our viewers are telling us that there appears to be no account taken of the fact that if the covering covers the mouth, that those with hearing issues are unable to lip read and are therefore excluded. What's your view on that?
Well, I can only really refer, Tom, to the clinical advice that we have, and I do accept that there will be people with very personal circumstances. I mean, ultimately in Wales, we are not giving a direction for people to have to wear that. So hopefully that does allow the fact that if people, have some inability to be able to communicate in the way that we would normally expect or have difficulties, that certainly our advice and guidance shouldn't be getting in the way of that at this stage. But I would revert to what I said, really, that the Chief Medical Officer is giving advice that is to the discretion of the individual and to make that choice for themselves. Okay, thank you very much. I'm just going to allow for one further question, if that's okay. So I'm just going to go over to Owain Clark at BBC Wales. So Owain, I think you might have a further question for me.
Hello. On testing and tracing once again, can you hear me now?
I can hear you, Owain, thank you. Yes,
there's fantastic a small delay. News. Yesterday, the Welsh Government announced it had 9,000 capacity in the system to conduct tests. The day before yesterday, we know only about 2,000 tests actually took place. What I can't quite understand is the disconnect between those two numbers. Is it the case that testing capacity has been saved up for what happens next week? Is that the case?
I don't think it's a question of the capacity saving up. Certainly to move into the test, trace and protect approach, it's really important that we are able to have more capacity available, and certainly being over 9,200 tests per day, we would expect that to increase shortly over 10,000 as well, is in line with what we would require for that more population-based approach and surveillance. In terms of the general usage, whilst on the one hand we've been trying to make it easier for those that need to access the services, we've also been able to make sure that some of the key workers, for example, over recent weeks have been able to be processed. So there is good access for healthcare workers, there is good access for the care home sector, for other essential workers at this stage. But I hope that in terms of any outstanding requirements, we will still be in a position where, by extending the portal access tomorrow, which is to both the public and also to our key workers, so they can actually book the drive-through centres through the UK web approach, that will actually allow us to increase any residual numbers within our system. But I think openly, Owain, where we are, I think that probably at this stage community transmission is contributing to those numbers, but the step up in the contract tracing requires those higher numbers anyway.
Thank you.
Okay, thank you very much. I think that's the end of the questions for this afternoon. Thank you. Diolch yn fawr iawn.